November, you did a procedure live on television on this guy. His name is TJ. And if people weren't watching, what did you do here?
So we used our LaserTight, went in through a little needle incision here, not even an incision, a hole, and basically vaporized all the fat under his eyelids. And he came back for photographs 3 months later, which is the below shot, and you can see it's gone, the skin is tight. It's a terrific result.
And you're able to physically see where the puffy is and where the puffy is not, right?
That's correct, because it's puffy here and it's smooth there.
Okay, and you actually say, as a side note, you're surprised that he did so well because you've actually done surgeries that are just as good as this.
Correct. This is the neat thing about this is it's in the office, local anesthesia, and prior to this technology, this was a trip to the operating room with an anesthetic.
Okay.
A thorough physical examination is an important part of understanding which patients are good candidates for EyeTight therapy. Patients with poor lid tone are not good candidates for this technique. In order to document lid tone, a snap test and a pinch test should be performed on every patient prior to therapy. In addition, it's important to document the presence of fat pads and the location of the fat pads. While the fat pads are traditionally in 3 compartments, it's always worthwhile to outline those compartments as part of your preoperative marking. Laser energy must be applied to each of these fat pads in order to vaporize fat sufficiently and create the desired result. The needle goes into the lateral canthal region in a crow's foot line, heads inferiorly through the skin to the orbital rim. And you want to feel the needle along the orbital rim. Then the needle is aimed medially along the orbital rim until you get some resistance. And that's the orbital septum. Then push anteriorly with the needle. The fiber is still retracted in the needle. I haven't advanced it yet. The needle is now parallel to the lower eyelid, to the orbital rim, and I'm in the medial fat pad, and I'm going to push the fiber in, and now you can see it in the fat pad. And we're still in standby mode, so now we're going to go to the ready mode. It'll load the chip. So I'm going to step on the pedal. We're going to get 3 seconds of energy, and I'm going to keep my finger right on the Heaney beam. That was our 3 seconds. Now I'm going to retract it a tiny bit, and still in that pocket, go to I was inferior in that pocket. Now I'm going to go superior in that pocket. Laser on. That was our laser exposure of the medial fat pad. Now we're going to go into the central fat pad. And there's the beam. Parallel to the skin, parallel to the rim, laser on. Retract back a tiny bit. Laser on. Now, to get the lateral fat pad is a little slightly different turn of the needle. It's often helpful to remove the needle from the pocket. Vector of approach to the lateral fat pad is not so much horizontal but vertical. So you can see that I'm approaching the fat pad that way because it tends to be a little bit lateral and superior to the other fat pads. Now the fiber's in the fat pad, and you can see it's inside the dots that I outlined. Laser on. Three more seconds and we're done. That's treatment of that eyelid. Now we're going to go to the other side.